Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. If you're new around here, this podcast is a place where we have honest conversations about infertility, pregnancy loss, infant loss, and finding hope through our grief. Today's episode is a little different because I wanted to talk about something that has happened recently in the infertility and recurrent pregnancy loss world. The American Society for Reproductive Medicine, which is often called the ASRM, released its first updated guidance on recurrent pregnancy loss in more than a decade. Since many of us have walked through miscarriage and multiple losses, I thought it would be helpful to break down what exactly changed, what stayed the same, and why this matters. I'm not a doctor, and this episode is not medical advice. My goal is simply to share information from the updated guidelines and hopefully help you feel a little more informed before talking with your own healthcare provider. So why is this update important? The last major ASRM guidance on recurrent pregnancy loss was published in 2012. Think about how much research has changed in 14 years. We know more about genetics. We know more about miscarriage tissue testing. We know more about which treatments actually have evidence behind them and which ones don't. So having updated recommendations is a really important step. One thing that immediately stood out to me is how recurrent pregnancy loss is now defined. ASRM now defines recurrent pregnancy loss as 2 or more spontaneous pregnancy losses. The updated guidance also says the losses do not have to be consecutive to qualify for this evaluation. Previously, it had been 3 or more losses, and they did have to be consecutive losses in a lot of cases. Another important update is that the very early pregnancy losses that are confirmed by a blood or urine test can now be included, even if they were never confirmed by ultrasound. Unfortunately, though, confirmed ectopic pregnancies and molar pregnancies are excluded from this definition of recurrent loss. For many people, including myself, that have had early losses, this can feel very validating, but for those who have experienced the ectopic pregnancies and molar pregnancies, then it is invalidating in some ways because it's still saying that even though you had this type of loss, that it is not included in this definition, thus meaning that some doctors may not count it as the 2 pregnancies in a row needed to get their recurrent loss panel testing. Another major takeaway is that ASRM is encouraging a more targeted evaluation instead of ordering just every possible test for everyone. Rather than using broad testing panels routinely, the recommendation is now to base testing on your personal history, your medical history, and your specific risk factors. Now, this doesn't mean that they're trying to give everybody less care or less testing, but that they are trying to focus on tests that have the strongest evidence of actually helping to guide treatment based on your specific parameters. One of these recommendations that is receiving more emphasis is the chromosome testing of miscarriage tissue whenever possible. The guidance recommends considering this as one of the first steps in evaluating recurrent pregnancy loss, because doing so can help determine whether a miscarriage was related to any chromosomal or genetic abnormalities. And that information may influence what additional testing, or sometimes if you don't need additional testing, may be appropriate in your situation. The updated guidance also recommends screening for certain medical conditions when appropriate and possible. Examples of this might include thyroid disease and diabetes, because both of these can play a role in pregnancy outcomes for some individuals. Again, the emphasis on all of these is evaluating the whole person rather than just applying the same exact standard treatment and testing to everyone. So hopefully helping to get more answers for people instead of less answers because the right testing wasn't used. So one of the most talked about parts of this update is moving away from tests that don't have strong evidence. So the ASRM recommends avoiding the routine use of tests and treatments that currently don't have strong evidence of actually improving outcomes for recurrent pregnancy loss. Now, that doesn't mean that the tests or treatments may never help a person, but it means that the evidence today just isn't strong enough for them to recommend them routinely for everyone who is going through recurrent pregnancy loss. So research continues to evolve and recommendations will continue to change as new evidence becomes available. So one of the things that I was really encouraged to see is that the updated guidance specifically emphasizes emotional support and counseling. For all of us who have gone through any type of pregnancy loss or infertility, we know that this isn't just a physical medical diagnosis. It's grief, anxiety, it's fear. A lot of times it's trauma. I'm really glad to see that emotional care is being recognized as an essential part of caring for people that are experiencing this, instead of just an afterthought or something that, you get because you happen to go to a good hospital. Emotional support is something we all deserve when we are going through this, and it needs to be included. Every doctor, every hospital, everywhere. So one statistic that was included in the guidance that I wanted to share with you is that the ASRM notes that 50 to 80% of people who are dealing with recurrent pregnancy loss will eventually go on to have a successful pregnancy, even without medical intervention. Now, look, I know that hearing statistics can be complicated. I am definitely not comforted by them anymore after going through my losses and hearing lots of those thrown at me. And if you're in the middle of a loss, hearing numbers like this doesn't erase the pain. But I also know that many people listening right now desperately want hope and something to cling on to. Yes, hope doesn't guarantee a particular outcome, but it does remind us that it is still possible. If you've experienced pregnancy loss, whether it's one or many, I hope this episode helps you feel a little more informed about these changes. If you've been told your losses don't count because they happened early, if you've wondered whether you should ask for additional testing and evaluation, or if you've been overwhelmed trying to understand all of the different tests and treatments you see online, these updated guidelines may be worth discussing with your doctor. Every person's story is unique. Every pregnancy is unique. And every treatment plan should be individualized and based on your personal history. If today's episode resonated with you, please consider sharing it with someone who may need it, or leave a quick review on Apple or Spotify. It really helps more families navigating infertility and loss find these stories. Thank you so much for tuning in, and remember, we are all in this together.